When the Tea Party patriots learned last night that Speaker of the House Nancy Pelosi was going to be unveiling the House health bill today on Capitol Hill, they sprung into action. Evan McMorris-Santoro of Talking Points Memo reports that an email signed by your Tea Party Patriots National Coordinator team rocketed among the nation's Tea Partiers last night, calling for protesters to mob Speaker Pelosi's speech. The Twitter messages soon followed, and the Tea Party flash mob was thereby summoned. About 10 of them turned up, which technically sort of makes it more of a flash pickup basketball game than a flash mob. But still, the aforementioned TPM reporter asked one of the 10 protesters if she was part of the online organized flash mob, and she replied, quote, "If this is organized, we suck." What did materialize in front of the Capitol today was the House Health Bill, a mashup of the 3 previous forms of the legislation that had been approved in House committees.
The bill will expand coverage, including a public option to boost choice and competition in the health insurance reform.
From the 1,900-page bill came many variations on one very brief headline, like this representative one in the Washington Post: House Healthcare Reform Bill to include public option. Or this one from the Los Angeles Times: House Democrats unveil healthcare legislation including public option. Headlines. You know, there's a reason why haiku is rarely made into movies. It's hard to tell the whole story in 17 syllables. Substantively, what the 1,900-page bill really means is that there is a health reform proposal that they think would expand health insurance to 96% of Americans. Another 36 million people who aren't insured now would supposedly be insured under this plan. And it could have done a whole lot more and saved the country a lot more money if the Blue Dog conservative Democrats hadn't gotten so much of their way, which they did. The Blue Dog Caucus, the conservative Democrats in the House, the people who sell themselves as the fiscally responsible wing of the party, wanted and got a health reform bill that will cost roughly $85 billion more than what many progressives wanted. Specifically, the public insurance option in the House bill will feature rates negotiated with doctors and hospitals the same way it works with private insurers. A cheaper and what they call more robust public option would have just tied reimbursement rates to Medicare. What it means in the end is that for the very few Americans who will even have the option of choosing the public option, in all probability that option will be a lot like just another insurance plan administered by a private health insurance company. They're purposely blocking themselves from using the buying power, the negotiating power of a big public plan to get a good deal for consumers. They could do it, but the Blue Dogs insisted that they don't. Congressman Dennis Kucinich is among the progressive Democrats today who have raised some concerns about the bill.
Is this the best we can do? Mandating private insurance, forcing people to buy private insurance policies or pay a penalty, guaranteeing at least $50 billion in new business for the insurance companies? If this is the best we can do, then our best isn't good enough, and we have to ask some hard questions about our political system, such as health care or insurance care, government of the people or government by the corporations.
Fired up, ready to go. Joining us now is Democratic Congressman Anthony Weiner of New York. He's been a fierce advocate of not only the public option, but of Medicare for all from the beginning. Congressman Weiner, nice to see you.
Thanks for having me back.
Do you agree with my take on this, which is that the Blue Dog Democrats got a lot of their way in terms of defining what's in the ultimate bill?
Well, yes. I mean, a strange thing happened on the way to the forum. When John Boehner said several weeks ago, I haven't met anyone who supports the public option, I launched this website called countdowntohealthcare.com saying, send people petitions to tell John Boehner he's wrong. Well, one by one, people were writing me, says, you're focusing on the wrong guy. You really have to be focusing on your own Democrats. And they turned out to be right. The strange irony is that someone gets called a fiscally conservative or a budget hawk, and then they go out and say, don't have as much competition, don't have as much choice, and don't keep costs down as much as we can. And then people say to progressives, are you going to vote for this watered-down bill? The real question, who's forcing it to be watered down? If we were truly representing what a majority of the country and the majority of the House and the Senate wanted, we'd have a much tougher bill. But look, all that being said, I think it's still a good bill, but it could have been a lot better if it had not been for the watering down of the public option.
You were quoted by Politico.com earlier today saying that the president has to get in here a little bit. In terms of making the bill better by the time we've got something final, what do you think President Obama could do now to help make it better?
Well, for one thing, say the words public option, here's what I want, here's what I think I can get. You know, Nancy Pelosi, to her credit, has been left to try to round up votes for a tough public option without much help from the other end of Pennsylvania Avenue. You know, the idea that the president could have maybe come in and said, you know what, here's 10 guys that I can sway. If the president of the United States calls, it's tough to say no. We've kind of been left to do this on our own, and you really need the full-throated support of a president at a moment like this when we're having a big national debate. Now, maybe he's right. Maybe this was the right time, and now he's going to step into the ring and do this. But really, I don't think we can close this out unless the president really helps us.
As part of the House Democratic bill, Speaker Pelosi reportedly went back on a deal that she had made with you to allow a vote on a single-payer health plan. Is that true? What do you have to say about that?
Well, I don't know. You know, Nancy Pelosi publicly gave a word to me that we were going to have a chance to vote on a plan like Medicare for all Americans. As I sit here, she has not told me anything else, but, you know, kind of like the old Casablanca line, I would not be shocked to learn that there's politics going on in Washington. But Nancy Pelosi is an honorable person, and she has been standing in as tough as she could for this public option. Unfortunately, she's been buffeted by members of her own party who have said, you know what, we don't want it to be that tough. We don't want competition to be that tough. And unfortunately, those people, whether they did it willfully or not, are doing the bidding of the health insurance companies, and that's regrettable.
A lot of progressives have looked to you over the last few months in health reform as one of the most articulate champions, really, of the idea of Medicare for all, of the idea of government-run health care not being such a terrifying idea. What is it that you are going to be pushing for between now and the final bill in terms of amendments, in terms of improvements that you think are actually within your reach? Well,
one of the things we're doing on countdowntohealthcare.com is pivoting towards the Senate. We have to make it very clear to the senators over there, we at least want to have a debate on these things. Is it so impossible to believe that we should just be able to get a yes or no vote out of the senators on the notion of a vigorous public option? Secondly, we need to make sure that we don't backslide anymore in the House bill. You know, many people don't realize this, but many of us wanted Medicare for all Americans, not just those 65 and older. We've compromised a long way here. We don't feel that sense of compromise by some of our more conservative friends. It's been kind of our way or the highway, and I resent that, and I think a lot of Americans do. So we're trying to help, and we also want to try to animate the president here. We'd love to have the president say, okay, you know, I know last time when President Clinton did it, we didn't let the legislature do enough of the work. Now maybe it's the time for the president to stand up. Here's why we need a strong public option. Here's why I want it coming out of conference. So if we get those elements, get the Senate at least having a vote, get the House members saying we're not going to slide much more than this, and get the president pushing us in the other direction, I think that this is well worth a fight that we can win.
Congressman Anthony Weiner of New York, thank you. Thanks for coming in.